Are you struggling with managing insulin resistance due to diabetes? Finding the right medication can be a daunting task, but two popular options that you may come across are Avandia and Actos. In this video, we will explore the effectiveness and benefits of these diabetes medications in the management of insulin resistance. Understanding insulin resistance and its role in diabetes. Insulin resistance is a condition in which the body's cells become less responsive to the effects of insulin. Insulin is a hormone that helps regulate blood sugar levels by allowing glucose to enter cells for energy production. When insulin resistance occurs, the body's cells have a reduced ability to take up glucose, leading to elevated blood sugar levels. Insulin resistance is a common feature of type 2 diabetes, a chronic metabolic disorder characterized by high blood sugar levels. The condition is often associated with obesity, sedentary lifestyle, and poor dietary choices. Managing insulin resistance is crucial in the management of diabetes, as it helps improve glycemic control and reduces the risk of complications. Efficacy of Avandia in managing insulin resistance. Avandia, also known as rosiglitazone, is a thiazolidinedione (TZD) medication that works by increasing the body's sensitivity to insulin. It activates specific receptors in the body, which then leads to improved glucose uptake by cells. Several studies have demonstrated the efficacy of Avandia in managing insulin resistance and improving glycemic control in patients with type 2 diabetes. One study published in the New England Journal of Medicine found that Avandia significantly reduced HbA1c levels, a measure of long-term blood sugar control, compared to a placebo group. The study also showed improvements in insulin sensitivity and lipid profiles. Avandia is typically prescribed as an adjunct to diet and exercise in patients who do not achieve adequate blood sugar control with lifestyle modifications alone. It is available in tablet form and should be taken as directed by a healthcare provider. However, it is important to note that Avandia has been associated with an increased risk of cardiovascular events, such as heart attacks and strokes. Due to this safety concern, the use of Avandia has been restricted in some countries, and it is only prescribed when other diabetes medications are not suitable or effective. Efficacy of Actos in managing insulin resistance. Actos, also known as pioglitazone, is another thiazolidinedione medication used in the management of insulin resistance and type 2 diabetes. Like Avandia, Actos works by improving insulin sensitivity and promoting glucose uptake by cells. Numerous studies have demonstrated the efficacy of Actos in improving insulin resistance and glycemic control. A study published in Diabetes Care found that Actos significantly reduced HbA1c levels and improved insulin sensitivity compared to a placebo group. The study also reported beneficial effects on lipid profiles and markers of inflammation. Actos is typically prescribed as an adjunct to diet and exercise in patients with type 2 diabetes who require additional blood sugar control. It is available in tablet form and should be taken as directed by a healthcare provider. Unlike Avandia, Actos has not been associated with an increased risk of cardiovascular events. However, it has been linked to an increased risk of bladder cancer, especially with long-term use. Therefore, healthcare providers must carefully assess the potential risks and benefits of Actos before prescribing it to patients. Side effects and safety concerns of Avandia. As with any medication, Avandia can cause side effects. Common side effects include weight gain, edema, swelling, and mild anemia. These side effects are generally mild and resolve on their own or with dose adjustments. However, the most significant safety concern associated with Avandia is its potential to increase the risk of cardiovascular events. Several studies have reported an increased risk of heart attacks and strokes in patients taking Avandia, especially in those with pre-existing cardiovascular conditions. Due to these safety concerns, Avandia is not recommended for patients with a history of heart disease or heart failure. It should only be prescribed after careful consideration of the potential risks and benefits, and patients should be closely monitored for cardiovascular side effects. Side effects and safety concerns of Actos. Like Avandia, Actos can cause side effects. Common side effects include weight gain, edema, and mild anemia. These side effects are usually mild and transient. The most significant safety concern associated with Actos is its potential to increase the risk of bladder cancer. Several studies have reported an increased risk of bladder cancer in patients taking Actos, especially with long-term use or high doses. Therefore, Actos should be used with caution, and patients should be monitored for signs and symptoms of bladder cancer, such as blood in urine or frequent urination. It is important to note that the risk of bladder cancer with Actos appears to be dose-dependent. and the benefits of the medication should be carefully weighed against the potential risks. Healthcare providers should consider alternative treatment options for patients at high risk of bladder cancer or with a history of bladder cancer. Comparing Avandia and Actos in terms of effectiveness and safety. Both Avandia and Actos have been shown to effectively improve insulin resistance and glycemic control in patients with type 2 diabetes. They belong to the same class of medications, thiazolidinediones, and work by increasing insulin sensitivity. However, when it comes to safety concerns, Avandia has been associated with an increased risk of cardiovascular events, whereas Actos has been linked to an increased risk of bladder cancer. Therefore, healthcare providers must carefully consider the individual patient's risk profile and choose the medication that offers the most benefit with the least potential harm. It is important to note that the use of Avandia has been restricted in some countries due to its cardiovascular risks, while Actos remains available with precautions for bladder cancer monitoring. Ultimately, the choice between Avandia and Actos should be made in consultation with a healthcare provider, taking into account the patient's medical history, risk factors, and treatment goals. Choosing between Avandia and Actos, factors to consider. When choosing between Avandia and Actos, several factors should be considered. Efficacy. Both medications have been shown to effectively improve insulin resistance and glycemic control. However, individual responses may vary, and healthcare providers may consider factors such as HbA1c levels, fasting blood glucose levels, and overall treatment goals. Safety concerns. Avandia is associated with an increased risk of cardiovascular events, while Actos is linked to an increased risk of bladder cancer. Healthcare providers should carefully assess the patient's cardiovascular and cancer risk profiles before prescribing either medication. Medical history. Patients with a history of heart disease or heart failure may not be suitable candidates for Avandia due to its cardiovascular risks. Similarly, patients with a history of bladder cancer or a high risk of bladder cancer may require alternative treatment options to Actos. Patient preferences. Patient preferences and lifestyle factors should also be considered. For example, if a patient has a strong family history of bladder cancer, they may prefer to avoid Actos despite its potential benefits. Ultimately, the choice between Avandia and Actos should be tailored to the individual patient's needs and should be made in consultation with a healthcare provider. Alternative treatment options for insulin resistance and diabetes management. In addition to Avandia and Actos, several other medications and treatment options are available for the management of insulin resistance and type 2 diabetes. These include metformin. Metformin is a commonly prescribed medication for the management of type 2 diabetes. It works by reducing glucose production in the liver and improving insulin sensitivity. SGLT2 inhibitors. Sodium glucose cotransporter 2, SGLT2, inhibitors are a class of medications that work by blocking the reabsorption of glucose in the kidneys, leading to increased glucose excretion in the urine. They have been shown to effectively lower blood sugar levels and have cardiovascular benefits. GLP-1 receptor agonists. Glucagon-like peptide 1, GLP-1, receptor agonists are injectable medications that work by increasing insulin secretion, slowing gastric emptying, and reducing appetite. They have been shown to improve glycemic control and promote weight loss. Lifestyle modifications. Lifestyle modifications, such as regular exercise, a balanced diet, and weight management, play a crucial role in the management of insulin resistance and type 2 diabetes. These interventions can improve insulin sensitivity and help control blood sugar levels. It is important to note that the choice of treatment depends on several factors, including the patient's medical history, risk factors, treatment goals, and individual preferences. Healthcare providers should work closely with patients to develop personalized treatment plans that address their specific needs. Conclusion: making an informed decision about Avandia and Actos. Avandia and Actos are two commonly prescribed medications for the management of insulin resistance and type 2 diabetes. Both medications effectively improve insulin sensitivity and glycemic control, but they come with their own set of unique characteristics and risks. Avandia has been associated with an increased risk of cardiovascular events, while Actos has been linked to an increased risk of bladder cancer. Therefore, the choice between Avandia and Actos should be made in consultation with a healthcare provider, considering the individual patient's medical history, risk factors, and treatment goals. It is important to note that alternative treatment options, such as metformin, SGLT2 inhibitors, GLP-1 receptor agonists, and lifestyle modifications, are available and should be considered in the management of insulin resistance and type 2 diabetes. By understanding the efficacy, safety concerns, and alternative options, individuals can make informed decisions about their diabetes management in consultation with their healthcare providers. Remember, effective management of insulin resistance plays a vital role in achieving optimal glycemic control and reducing the risk of complications associated with diabetes.